Hi, my name is Matthew.
Hello, my name is Tad Yang.
Hello, my name is David Ying.
Hi, I'm Eric Yang.
Today I'm going to be presenting to you about the Hmong community and health issues that affect it within the Sacramento area. There is an increasing need of health research focused around the growing minority population of Asian Americans within the United States. One of these communities that we focused on was a Hmong community within the Sacramento area. We asked ourselves, what are some of the underlying factors that contribute to health issues within this community? Through examining data collected on BMI, education, and income, we were able to come to a conclusion regarding the correlation between these factors. We hope that by conducting this research, it will motivate further in-depth research on socioeconomic factors and help us better address the underlying health issues that affect the Hmong community.
The data for this study was done by Hlub clinic interns who took surveys and vitals of patients from various locations around the Sacramento County. Among these locations included Sacramento Hmong New Year's and Hmong Youth Parents United events, such as their farmers market, National Night Out, and their senior workshops. The data was collected from June 2019 to November 2019, with a total of 81 responses being recorded. 53 of these responses were females, 23 males, and 5 unspecified, and they were taken and analyzed through a basis of comparative analysis. The surveys we held contained questions asking about the patient's age, zip code, level of education, and annual house income, while the vitals taken from the patients included their height, weight, both of which would be used to calculate their BMI, heart rate, respiratory rate, temperature, blood pressure, and upon the patient's agreement, their blood glucose. We used the Asian BMI scale, which would provide us with a better analysis of the population we are studying. Furthermore, we used the 2020 poverty guidelines from the Federal Register to set the cutoffs that we would consider to be in poverty in this study.
Although we had 81 participants in our population, our sample consisted of only 11 participants, as we only considered participants who were of Hmong ethnicity and had fully completed the survey as that best fit the target of our study. Participants were categorized into one of two groups: formal education and annual income above poverty line, or no formal education and annual income below poverty line, based on their responses to the survey. As displayed in the table, 6 of the participants were placed in the formal education and annual income above poverty line group, and the remaining 5 participants were placed in the no formal education and annual income below poverty line group. Furthermore, we specified each participant's highest level of education and their annual income. We calculated each participant's BMI and classified their BMI rating using the Asian BMI scale. The 4 BMI classifications were underweight, healthy, overweight, and obese. The bar graph signifies the lack of diversity in BMI classifications in the no formal education and annual income below poverty line group, as participants' BMI in that group were only either overweight or obese. In addition, the box plot displays that the no formal education and annual income below poverty line group had a higher range of BMI values compared to the formal education and annual income above poverty line group. We found that the formal education and annual income above poverty line group had a mean BMI value of 24.93, whereas the mean BMI value was 28.24 for the no formal education and annual income below poverty line group. We conducted a 2-sample t-test to calculate the average differences and found a test statistic of negative 2.32 and a p-value of 0.0263. Therefore, we are 97% confident that individuals with formal education and an annual income above poverty line have significantly lower BMI values compared to individuals with no formal education and an annual income below the poverty line.
The results from our data suggest that participants of Hmong descent with low income and no formal education have a higher BMI as opposed to their more affluent members. Thus, when addressing the health of the Hmong community, it is required that the health intervention efforts must consider and address the socioeconomic status of these populations in order to effectively provide care for their community. Although our data pool is very small, we plan to use this research as a stepping stone for further studies on the Hmong community and how we can better the health of this group. We recognize that the culture and religion of the Hmong community is heavily influential on their typical diet. In addition to this, we also understand that communities who are considered to be underserved have limited access to nutrient-rich foods. As a result, this community could be limited to foods that are rich in caloric content but low in nutritional value. Hopefully, our current research will provide us with more data that can be used to establish stronger claims and assist with ideas on how to promote healthy lifestyles in the Hmong community. The reason our data pool is very small is because a lot of our surveys used to collect data were not completely filled out. The completion rate of our survey was only at 27.5% for our Hmong participants. This could be due to aspects of the language of our surveys, but also the audiences of Hmong people that we were able to have contact with. Most of our data was collected at cultural events, which creates a bias in our data as it ignores a proportion of the population that cannot attend these select events. Furthermore, our surveying strategies need more refinement as our actual surveys fail to consider family incomes and how they affect our overall data pool.